Thank you for the opportunity, and I'm glad that to see you and all my participants having a great time. I have been actually going into master classes, some of the workshops, and sitting at least few of them because I wanted to get the real experience of the participants. And for the scientific sessions in the afternoon, I tried to listen to multiple ones rather than sitting in one.
Yes.
And they had been really good, well attended, people are
Excellent.
engaged. And the topics that we selected are vast, varying. So whether you are doing an obstetric or you're a cardiac anesthetist or a pain specialist, for example, today.
Yes.
So in the afternoon session, we have obstetric session running. There's a cardiac session
It's
running.
so much
and
variety.
there's a pain. So I did attend your Wali breakfast, and I did like the fact that you said we could actually, as women and in leadership position, we could inspire. But what made me think is sometimes we need to search those people because they don't come. Some people have the ability, but they don't even know that they have the ability. They have the aspiration to become a leader, but they don't know how to get there.
That's right. I talked about that in The Power of Three, wasn't it?
Yeah, that's exactly.
Three women's names that you can nominate. Yeah.
Absolutely. So that was good. Today I attended a ventilation workshop, masterclass.
Yes. Was that with Professor
Javier Fernandez, who was sponsored? He gave me the perspective like how much PEEP matters in patients.
Yes.
So the PEEP makes a big difference so we are not ventilating patients just to get the CO2 out.
Yeah.
It's more about how we're going to oxygenate and keep oxygenate, prevent alveolar collapse, post-operative complications.
Yes.
That's more important than just finding our SpO2 oxygenation saturation.
That's right. SpO2 is late. I remember that. He had great videos in his talk, didn't he?
He did a great ventilation talk. He was very precise, and he's, of course, an expert.
Yes.
Right? So
that's lovely. And everyone who's listening to this afterwards, get your PEEP on.
That
was the take-home message, wasn't it?
That is
Get your PEEP on. All right.
Very true.
Well, lovely. Thank you so much, Grace. Thank you for all your hard work. It's been a fantastic Congress. I've had so much positive feedback from it here at the booth and around the place. Thank you.
And thank you for doing this podcast because I think lots of people have come and spoken to you.
Yes.
I wish that we do get feedback, but not like the people who could actually, because if I ask someone, they would always say it's nice, but if you are sort of not in the committee, so it is a good thing.
Yes.
They'll tell you the real what they think, and it's not about criticizing or giving feedback. We want to improve every time.
Exactly.
As an ASA, we want to do things differently every time.
We want to get better.
Exactly. So thank you for your contribution.
Lovely. Thanks, Grace.